But he's not Superman, you know? I mean, knowing Izzy, he's worked very hard at it. Probably listened to a lot of hearts. It's your first-year fellow. You'll get it.
Hey, Nat.
Yeah.
I pulled this out of the gut of a 14-year-old girl. Any idea what it is?
I have never seen anything like it.
Me neither. Care to find out?
Yeah.
Shannon, Mrs. Fisher, this is Dr. Manning.
Hi.
Hi.
We removed this foreign body from your stomach.
That was inside her?
What is it?
Shannon?
It's mine. I need it back.
Is that something you made in the basement?
You made that?
Tell them what it is.
It's a prototype.
For what?
A robot.
A robot?
The idea is you swallow it,
You swallowed that?
and it can clear blockages or repair intestinal wall without surgery.
Excuse me, clear blockages? It caused a blockage.
Okay, so it needs work.
What exactly goes on in your basement?
Shannon and her friends, they call themselves biohackers.
I'm a body hacker. Kyle and Jen are biohackers.
Biohackers, genetic engineering, a bunch of kids?
They make things. The DIY generation turned our basement into a lab. I can hardly get to the washing machine. I do not want you experimenting on yourself.
I'll second that.
Yeah, seriously, this was very dangerous. You could have cost yourself an operation.
You listen to the doctors.
Can I have it back? Please?
That's up to your mom.
Body hacking? They could really hurt themselves. Shouldn't we report this to someone?
Oh, it's not illegal, it's just crazy. Kids, where did they get these ideas? Listen to me, I sound like my dad.
Oh, your dad would be right.
Still, it makes you wonder what goes on there.
See ya.
Thanks.
How long's she been on chemo?
Multiple courses over the last year.
To get to this. Still in the dark ages. Done. Pete's cases.
You can go in now.
How is she?
It's too soon to tell. We have her on dialysis. That'll take over the function of her liver.
Is her daughter dying?
No. No, she's not. With dialysis, she will stabilize, and her labs should improve. Unfortunately, the damage to her liver could be permanent. She may need a transplant.
Oh my God, a liver transplant?
Another operation.
She's been through so much.
I know, but Haley's a fighter. I've seen these things turn around. We're not giving up. She could pull out of this.
Thank you.
Dr. Abrams?
Tell me if you concur.
Her pupils are large, sluggish.
What does that mean?
No. Wait.
Wait.
What aren't you telling us?
Unfortunately, the swelling in your daughter's brain is so severe that it's affecting the brainstem.
BP's spiking. 200 over 100. Heart rate's falling. She's crashing.
Call a code.
She's in BFib. 1 milligram of epi. Charge to 200. Now. Hold compressions. Clear.
Still in BFib.
Charge to 200. Another milligram of epi. Hold compressions. Clear.
BFib's fine, BFib.
Asystole.
Susan, she's gone.
Gone?
Are you sure?
Yes. May we stop?
Stop.
I need your permission.
Yes. Please, for God's sake, let her be.
No. Come on. Come on, baby. Come on.
We're culturing gut bacteria over here. Maybe we can reprogram some E. coli Nissels to boost the immune system.
But Nissel's not dangerous. So what level of safety are you operating at?
BSL 1, maybe 1.5. What we're doing here doesn't need more than that.
And who's supervising all of this?
Miss Herbert, our biology teacher. But I don't think she really gets what we're doing. She just tries to make sure we don't kill ourselves. Oh, this is cool. Kyle, show her the ear. He took a slice of apple and implanted it with HeLa cells.
The cellulose in the apple is kind of like scaffolding for the cells to grow on.
Wow. That really looks like an ear.
Well, it's not. I carved it to make it look like one.
But it's not apple anymore either.
Well, when I was your age, I was working with hippocampal cultures, studying the transduction pathways with short interfering DNA. I know, big deal. So 1995.
You were a science geek too?
Mm-hmm. And I would have killed to have a place like this. Let me ask you a question. What do you know about non-Hodgkin's lymphoma?
Blood cancer. Body produces a lot of abnormal lymphocytes.
How'd you like to give it a shot?
Diabetic?
No, but it's similar. MSX patients don't respond normally to insulin, which causes their body to create too much, and that leads to metabolic abnormalities. We're going to do a test to be sure, but there are certain dangers.
Is this thing treatable?
It's controllable through proper diet and exercise.
Wait. Jessica already eats right. And she exercises every day.
I know you've already seen several nutritionists.
And we've done everything they recommended.
I understand,
Why
but...
can't any of you doctors see past her weight? If diet and exercise are the treatment, then the diagnosis is wrong.
It might be. But the only way we'll know is if you let us do this test.
Increasing glucose to 6.9 milligrams per minute.
Are you okay?
I'm thirsty.
Just a little bit longer and you'll be done.
Like Dr. Chase.
Want to put some money on it?
I said I'm thirsty.
Just 5 more minutes, okay, sweetheart?
I'm not your sweetheart. Don't call me that.
Jessica, that's not nice.
They're the ones who aren't nice.
Jessica.
You're not either. I don't want to do this anymore.
Jessica, you have to calm down.
Let me go!
Check your blood sugar. She's got to be getting hypoglycemia.
Never seen it like this before.
Hey, calm down.
Go of me! Get it out of me! No, you son of a bitch! You bastard!
She's sedated. Mrs. Sims, don't worry. Hypoglycemia can cause temporary psychosis and is a common complication during an HEC procedure.
I never wanted it done in the first place.
We understand you're upset, but
You were supposed to be monitoring her condition, but instead you were bickering and placing bets.
I apologize if it looked like we weren't devoting our full attention to your daughter, but I assure you that we...
Oh, please, save your pathetic insincerity for your boyfriend.
You're wrong. She is, in fact, pathetically sincere. And they didn't screw it up.
Who are you?
I'm from the lab. The blood tests show your daughter was not hypoglycemic, which means her psychosis wasn't caused by anything these doctors did.
So then what was it caused by?
I have no idea. But you'll be happy to hear it cannot be cured by diet or exercise.
I would never do that.
Right, so it was her imaginary mom.
She didn't take any pills. The girl's lying.
Why would she lie?
Because she's another mean little jerk?
Mom,
I'm sorry, honey.
Clemmy didn't lie. I did. I took the pills. I told her you gave them to me because I didn't want to get in trouble.
Where did you get them?
I took them from the store.
Why? Why would you do that?
Because I didn't want to be ugly anymore.
Oh, baby, you're not ugly.
Yes, I am.
I know you don't think so, but I am. I'm disgusting.
Jessica, please don't say that.
I just wanted to fit in. You know, have friends. Or at least have one person my age be nice to me. Oh.
Listen, the pills cause blood clots, heart attacks, and insomnia. It explains everything. We'll keep her overnight to make sure, but she'll be fine.
Thank you.
The MRIs are rented, but did you make a decision?
He's not gonna fire anybody. Yes. I'm gonna cut the pay of all 4 of us. 17% across the board will allow you to keep us all for the same amount of money. I believe it's what you suits call win-win.
All right, if you can.
No.
If he can work it so we keep the current staff for the same amount of money, what difference does it make?
It's not about the money.
This is not a negotiation. It never was. I need to know that whatever I ask you to do, however distasteful you find it, you'll do it. And just as importantly, you need to know that.
Nothing on the adrenals. Heard Cameron went home. She's sick.
Go back to the pituitary views. She seemed okay.
Think she's got another reason for leaving?
I hope so. Wait, stop. There. What's that?
A tumor.
It's Cushing's.
The tumor causes Cushing's. Cushing's messes with hormone production. Hormones control everything. Growth, weight.
Can you fix it?
She'll need surgery to remove the tumor. Once it's gone, everything will get normal very fast.
No mastectomy?
No.
Thank God.
The surgery is dangerous. The pituitary is located between the cavernous sinuses, basically right between the eyes. The area contains the nerves that control eye movement and the major arteries that feed the brain.
Oh my God.
The surgeon will approach the gland transphenoidally. An incision will be made under the lip through which he'll insert a fiber optic microscope. Once the tumor is found, he'll cut it into small pieces and remove it through the same hole under the lip. The whole procedure should take about 3 hours, and your daughter should be able to go home in a few days. The sores will go away, as well as her fatigue and the muscle pain. She'll even start losing weight.
Jessica.
Hi.
Is that really you?
Yep, it's me.
You look fantastic.
She always looked fantastic.
Yeah.
Come on, man. Come on. I ain't done with you yet. I ain't done with you yet. My time is torso, dum-dum.
Shut up! Leave my kid alone!
Hey, cops! Wait out there!
How'd you know I'm a cop?
It was a lucky guess. How about we separate the guys who just shot each other?
Actually, I was the one who shot him.
Where's my drink? Legs on fire.
Shut up, crybaby.
Man, you keep running your mouth. Go ahead.
Hey, don't call me mom, okay?
How old are you?
15?
15. What are you doing getting yourself shot? We're gonna call your mom. She'll want to be here when you get out of surgery. It's gonna be okay. It's gonna be okay.
Back at you, I swear.
Hey. Hey. Hey, my guy's coding.
Dr. Whitaker.
I'm right here. Charge 360.
Son of a... You forgot to say clear.
I got a pulse.
Come on. That Whitaker guy. So what are you gonna do first?
Make sure his vitals are stable.
Yeah.
Scheduled another surgery to remove the bullet from his hip.
What's this rash on his chest?
Was that there before?
I don't know.
He got shot through the hip. You know, maybe we should be worried about a fat embolism. We could give him heparin.
Heparin. Heparin's a blood thinner that's not indicated for FES.
We used it on the front lines. There are studies that show heparin can help.
Tell you what, I'll look into it. Let's give him a couple more hours, then bring him down to the floor.
Angel, can you help? Mr. Egerton got out of bed.
You okay?
Yeah, sure.
What happened? He can't breathe.
What's his sat?
79 when I got here.
Blood pressure?
I don't understand. You told me he was stable.
Your son had an embolism, Miss Washington. We've done everything that we can do, but he's been deprived of oxygen for too long. We've run some tests, and he's just not responding. I'm so sorry to tell you that he's brain dead.
No!
I'm so sorry. I'm so sorry.
No! He's not gone. Please. Tell me he's not gone.
I'm sorry, Mrs. Washington.
Look who it is. Hello? Hey, you better watch out for this guy. Let me know when you come in here.
He's unconscious and handcuffed to the bed. I think I'll be all right.
Why are you so mean? Many women are into the cop fantasy.
I'm seeing somebody.
Of course you are. What's he do?
He's a lawyer. About to become partner.
Bedrock of society.
At least he doesn't carry a gun. Oh, you think you're so different from this guy. They're all just little boys running around with guns. And none of you make enough money.
Oh, well, now we're getting somewhere. You need a dude with money. I'm not your guy, because I got credit card bills out the ass.
I bet you do.
My car's probably getting repoed right now.
I'm sure it is.
I was just gonna ask you if I could borrow $5. Look at that smile.
I gotta go, excuse me. Hey, the lawyer just invited me to the Costume Institute ball with him. That is a hot ticket!
Stop it, I told you.
Nice necklace.
Thanks.
You like video games?
Love them.
That should do it. You okay?
I want my bunny.
Are you being silly?
I don't know which one to take.
What do you mean? What's happening? I
thought arthritis was for old people.
JRA is an autoimmune disease. Her body's attacking itself, causing inflammation in the joints, her eyes, and her heart.
Is it treatable?
It can be crippling, but it can also go into complete remission. Well, the good thing is we caught it early. Gives her the best chance to have a positive outcome.
Oh, don't get up, Goosey. Stitches.
She's having a stroke. Stroke was caused by a clot in her middle cerebral artery. Started on TPA, should dissolve the clot and hopefully prevent brain damage, but we won't know for sure until she regains consciousness.
Well, she has another stroke. Arthritis, heart disease. Why can't this kid act her age?
JRA doesn't affect the blood. It means the clot's a symptom of something else.
It's a symptom of polycythemia. She's fully hydrated and her blood's still thicker than pancake batter.
Well, thick blood explains the stroke. It can also have caused an autoimmune response, which should explain the JRA kicking into gear. But what explains the thick blood?
Lack of oxygen forces the body to overproduce red cells.
What explains the lack of oxygen?
Carbon monoxide fumes, cigarette smoke.
Doubt our patient's a smoker.
Dad could be.
He's not.
He says he's not.
Hey! Don't make me turn the hose on you two. Chase is right. You two go check the house, see if Dad's a closet Marlboro man.
You're intentionally punishing us.
By making you do your job does seem kind of cruel, doesn't it? Take along a carbon monoxide detector to check for leaks, and you start her on hydroxyurea to control her red blood cell production. You got a Mark manual, medieval edition. Tell you how to drain a pint or two so she doesn't clot again.
You should take these back to where you found them.
Okay. Excuse me, can you make sure these flowers and this kid both get back to where they belong?
Sure.
Thanks.
Let's go. Come on.
Wait.
So you're just draining blood from her? You're not testing it? You're not fixing it?
Your daughter's vascular system is engorged with blood. Draining some reduces the chances of another stroke. We're also starting her on a drug that suppresses the production of red cells, so we don't have to keep doing this. Good chance she'll make a full recovery.
She hasn't spoken yet.
Give her time.
This is your boy? Where have you been?
Exploring. See ya.
Thank you. You know, you just can't run off without telling me.
Okay. Can I have $2?
Have you been abusing your daughter?
What? Why would you?
We found this hidden in a vent under her bed.
I don't know anything about this. Maybe she had a bloody nose?
We need to examine her for abuse.
You can't really think.
Maybe you, maybe the school bully, maybe the creepy neighbor. I'm guessing you're not paying as much attention as you should be. Do you even know where your son is right now?
Yeah, he was here a minute ago. She isn't being abused.
Unfortunately, that answer doesn't help me. If you have abused her, you're obviously gonna lie about it.
I'm not lying.
We need to do a vaginal exam.
No. She may be dying. She still can't talk, and you're gonna waste your time with this?
You consent, and we waste a few hours doing the exam, or you refuse, and I call social services. And they waste 3 days doing an investigation, which ends with them doing the exam anyway.
Okay, I'm gonna look inside your mouth. Open wide. Okay, now look at your chest and your back next, okay? I know you can't talk, so stop me if you get scared. Before you came here, did anyone hurt you? Make you bleed? I need to look in your vagina now. Do you understand? I'm a doctor, so it's okay. All right? Bend your knees, keep your ankles together, and just let your knees fall to the side, okay?
Jasper, you're not supposed to be up here.
Is that other doctor your boyfriend?
No. Your dad's probably looking for you. He's got enough to worry about right now.
Do you like him?
He's a friend.
Do you like him like him?
We should get you back to your dad. Let me put this down and I'll take you there.
I could be your boyfriend.
I think that wouldn't be fair to the girls your own age.
He seems like a tool.
He's not. And that's rude. Taking you back to your father.
Mass is small, about a centimeter across.
Firing the biopsy needle.
You nick an artery?
No?
She's in VTAC, no pulse.
Charging 50.
Clear. Clear. Clear.